You know, whether we're talking about the health of our oceans or the health of our own bodies, our world is just full of risk. And yeah, it can feel pretty overwhelming. But what if I told you there's a shared blueprint for understanding it all? Today, we're going to unpack a universal toolkit for navigating risk, and you might be surprised where we find it. Okay, let's get into it.
So, we're going to start here, out in the world's oceans. And look, this isn't just about fish, it's about people. A staggering 260 million people rely on fisheries for their jobs, for their livelihoods. I mean, we're talking about a massive, interconnected system that literally feeds and supports entire nations.
But this entire system, it's in trouble. Climate change is really starting to mess with our oceans. We've got warming waters, rising sea levels, more intense storms, and all of that threatens not just the fish, but those hundreds of millions of people who depend on them. It's a truly global-scale problem, and that calls for a global-scale way of thinking about it.
So how in the world do you even start to analyze a threat this huge? Well, scientists and policymakers, they use these really powerful tools, and one of them is the Fisheries At-Risk Index. Think of it as a framework, a way to make sense of all this complexity and pinpoint exactly where the danger is greatest.
Now, this whole index is built around a core idea from the Intergovernmental Panel on Climate Change, and what they say is risk isn't just one thing. It's actually more like a formula. It's what happens at the intersection of a hazard, your vulnerability to it, and your ability to respond. Let's break that down.
Okay, so it all comes down to this three-part structure. First up is exposure. What climate hazards are you actually up against? Are we talking stronger cyclones, ocean acidification? That's step one. Then step two is sensitivity. How much is this all going to hurt? I mean, a country that relies on fishing for 90% of its protein is way more sensitive than one that doesn't, right? And finally, there's adaptive capacity. What tools do you have in your toolbox to fight back? This can be anything from better boat insurance to retraining programs for fishermen.
And here it is. This is what it looks like when you put it all together. When you map those three factors, you get this amazing global snapshot of risk. You see those hotspots in pink and red? That's where high hazard exposure crashes right into high community sensitivity and, crucially, low adaptive capacity. You see it affecting small island nations near the equator, but also, and this is so important, nations way up north like Greenland, where the climate is changing incredibly fast.
All right, so that's the global scale. It's a really powerful way to understand entire ecosystems and economies. But now, we're going to make a hard pivot, a really hard pivot. So here's the question. What on earth could this big global model for saving fisheries possibly have in common with managing a personal medical treatment? Well, the answer, as it turns out, is everything.
So yeah, we're shifting our focus from the vastness of the ocean to the intimacy of the human body, specifically to the super complex world of a patient who is managing a serious illness, like hemophilia A.
What you're looking at here is a guide for a drug called Hemlibra. It is a truly revolutionary medicine that helps people with hemophilia prevent bleeding episodes. But like any really powerful intervention, it has its own dangers. So this guide, it's not just a set of instructions, it's literally a risk management plan. And the stakes here are just incredibly high. This quote from the guide lays it out, no minced words. When this drug interacts with another type of medicine, the side effects can be, and I quote, serious and potentially life-threatening. This is risk at its most personal.
Now, what's so fascinating here is what the actual hazard is. You see, it's not the disease itself. The real danger comes from the interaction between treatments, and the consequences are severe. Things like TMA, which causes clots in tiny blood vessels, and thromboembolism, which can block major ones.
So how do doctors and patients navigate this minefield? Well, get this. They use the exact same three-part framework we just learned about for fisheries. It's the same mental model, just applied on a totally different scale. I mean, just look at how perfectly it maps onto this situation. Exposure? Well, that's the powerful drug itself and its potential to interact with other medicines. Sensitivity? The patient's underlying hemophilia makes them uniquely vulnerable to these clotting complications. And the adaptive capacity? That's the medical team's expertise, strict dosage rules, and, this is key, very careful lab monitoring. This table is a fantastic example of adaptive capacity in action. See, Hemlibra can actually mess with some standard lab tests, giving you bogus results. But doctors know this, so they have a toolkit, a list of specific tests that are not affected.
This lets them keep an accurate eye on the patient's condition, building a safety net so they can use this powerful medicine safely. It's literally their version of having diverse fishing gear.
Okay, so let's bring these two very different worlds back together. We've got an ocean threatened by climate change and a patient navigating a complex medical treatment. They seem worlds apart, right? But they're actually governed by the exact same logic.
And this slide just lays it all out perfectly. On the left, you've got the global fishery. The hazard is a cyclone. The vulnerability is a community's economic dependence. Adaptation means having things like insurance and good regulations. Now look at the right. For the patient, the hazard is a drug interaction. The vulnerability is their specific medical condition. And adaptation, that's dose limits, lab monitoring, and patient education. The scale is completely different, but the blueprint, it's identical.
And that right there, that's the big takeaway. This three-part framework, hazard, vulnerability, adaptation, it isn't just for fisheries or medicine. It's a universal mental model. It is a toolkit that you can use to decode risk, whether you're a climate scientist, a doctor, or, just a person trying to navigate this complicated world.
So that leaves us with a final question for you. Think about the biggest risks in your own life, in your community, in your work. What are the hazards you're exposed to? What makes you sensitive to them? And most importantly, what's in your toolkit to help you build your own adaptive capacity?